This video is about needling the trapezius trigger points, which, if done correctly, is a fantastic treatment for lots of neck and shoulder problems. However, due to the position of the lung, an incorrect or very poor needling technique can become unsafe very quickly due to the position of the lung. So as with all trigger points, the first step is to firstly position your client appropriately. For the trapezius, you want the arm to be dangled over the side of the bed, which puts the trapezius muscle in a mid-zone position, so it's not overly stretched, which makes it very hard to lift and effectively safely needle the muscle. And it's not up like the left arm is, where the muscle is very contracted and again hard to get into and not as effective as if it's in the mid position. Next, you locate the trigger points by rolling those fibres of trapezius in between your fingers and locating that little hard marble in there. Position the needle appropriately over it and aim in a PA direction, straight forwards or straight down into where the trigger point is. Grab a hold of the muscle, making sure your fingers are spaced behind, so if the needle were to penetrate all the way through the muscle, it wouldn't go straight into your finger and give yourself a needle stick injury. And then lift the muscle, so you're lifting it up away from the top of the lung. Then you can start to push the needle into the muscle once you know it is away from the lung itself. You can continue pistoning that muscle in the continued PA direction. Don't change going downwards. You can go side to side, but don't go down into the top of the lung. Until you find that trigger point and it starts reacting. If you need to give the patient a rest for a little bit, step away, obviously take your hands away. But when you go to start needling again, make sure you re-lift the muscle, make sure your fingers are away from the other side. And there you have it, safe needling of fibres of trapezius. And make sure you warn your patient they're going to be a bit achy afterwards, but their symptoms will be so much better.